Hello, good afternoon. This is Dr. Do again. This video is alphabetic list problems. Last time I thought we were going to move on to letter E, but today I changed. I thought there's something else I need to talk on the letter D. Diverticulosis and diverticulitis. So which is quite common in older people. What is that diverticulosis? Any emergency? Yes. Let's just talk about emergency situation. Diverticulosis is actually a multiple diverticuli. So if the problem associated with the bleeding usually is the bright blood per rectum. So if that's the emergency situation, or the inflammation diverticuli can on top of that diverticuli can have the inflammation or diverticulitis. So if diverticulitis is not corrected on time, just like the appendicitis, it could have the perforation. So both of this situation is emergency. What are the signs? Like diverticulosis have the bleeding, so that's an emergency. Diverticulitis, if you left a lower abdominal pain associated with fever, nausea, vomiting, exactly symptom like the appendicitis, just the opposite. Appendicitis, is on the right lower quadrant of abdomen, and this diverticulitis is on the left lower quadrant of abdomen. So what are the diverticulum? So the single form diverticulum, the multiform diverticuli, and diverticulitis. Diverticulosis means the disease which multiple diverticuli. It's kind of medical, fancy term, fancy medical term. Anyway, before we understand the diverticuli or diverticulum or diverticulosis, let's understand the wall of the intestines, either small intestine, large intestine, or even stomach. So we know the digestive system is formed by majority of the hollow organs, start from esophagus to the rectum, and also exocrine organs like pancreas or liver either secrete the bile or secrete the digestive enzymes like lipase, amylase, peptides to digest the protein, carbohydrates, and lipids. So the hollow organs, they have the wall structure. So usually the wall structure has 4 layers: the mucus layer, submucosal layer, and the muscular layer, and the serous, the most outer layer, serous tissue, membrane tissue. So these are the structures has very unique function, affiliated structures. For example, the stomach. Stomach has the mucus level, mucus and submucosal tissue, and also the muscle for the stomach has 3 layers. Not like this intestines has 2 layers, either circular or longitudinal, to facilitate with the motion of the segmental or peristalsis. A stomach, since the function of stomach is a grinding, so after the food swallowed from esophagus down to the stomach serving as a grinding. So the muscular level layer has the circular, so moving when contracted, moving in this direction, has longitudinal, so one contraction of moving in this direction to squeeze, and there's an oblique layer, so then in the other direction. So basically the stomach keep just moving in this multiple direction to grind the food, to facilitate absorption of the small intestine. So having said that, let's back to the normal or the main topic of diverticulosis. It's a porch structure, which is protrusion of the wall structure outside. What does that mean? It's the mucus, submucosal tissue, muscular tissue, and even the serous membrane tissue, all protruded out like a little porch. Hidden, could be very deep. So then this kind of a structure, a porch-like structure, can undergo inflammation, which is diverticulitis, or undergoing the blood vessel was injured or damaged, so cause blood vessel or cause the bleeding. There are a situation called pseudo diverticulosis, which means the not full layer of the intestine walls to porch out, only part of them. So that's the pseudo diverticuli. It can, since it is pseudo, so not as deep as the diverticuli themselves. So the chance of infection is lower, but still have a chance of infection. So having said that, then what is the problem complication? Like I said, either the diverticuli had the blood vessel was trapped inside and caused bleeding. So that's the bright blood per rectum. So that is emergency situation. See the physicians either use scope to clog the blood, so stop the bleeding, or if it is inflammation, just like the appendix, food probably falling into this little porch diverticulum structure stuck there, cause the inflammation, bacterial growth, then cause the diverticulitis. The symptom is acute. It's feel left lower quadrant abdominal pain, nausea, vomiting, maybe may have fever, and also even can have rebound, just like the appendicitis. Depends on how severe the infection is, how the inflammation, how severe is the inflammation. So having said that, what is the treatment I mentioned? Regardless of what the situation, you need to see a physician, and preventively do the colonoscopy every 10 years if without any family history of colon cancer or any inherited genetic disease. Every 10 years for the colonoscopy, or the sigmoid scopy. So the scope just going short to the sigmoid. Actually, the major occurrence site for the diverticulosis is on the sigmoid, which is just above the rectum. That's small, like a S-shaped large intestine. So do the scope every 5 years or 10 years to check it. And the other thing is a healthy diet. Prevent the food stay in the large intestine for longer time. So high fiber diet to facilitate with the bowel movement, to decrease the chance of infection. So these are the could be common in. I have seen these patients in the older people, because of the wall structure undergoing the degenerative changes. So could happen in older people, older than 50 years old. So that's the colonoscopy or the sigmoidoscopy can help to identify early and to let you know, to prevent and promote bowel movement, prevent constipation. It's kind of simple, but it's very effective to prevent. So I'm wrapping it up as a summary. So if we have the left abdominal pain, fever, nausea, vomiting, and call your physician or go to the emergency room. The sooner the better, because otherwise, if the inflammation severe, can cause the perforation, or if you have the blood actually painless blood from the with stool. So if that's the case, also go to emergency to get treated. So that is video for today, and thank you for watching. I will see you next time.